Welcome to today's section. Today we will be discussing about the chemotherapy of tuberculosis. As we all know, tuberculosis is a chronic granulomatous disease caused by Mycobacterium tuberculosis. In developing countries like India, we know that it is a major public health problem and even 5 lakhs people die in India every year due to this disease. Today, we will be discussing in detail about the chemotherapy of tuberculosis, the drugs that are used in tuberculosis, and the mechanism of action of tuberculosis drugs. So just we'll see the introduction. Tuberculosis is a chronic granulomatous disease and it is a major health problem in developing countries. About 1/3 of the world's population is infected with Mycobacterium tuberculosis. In India, control and treatment of tuberculosis is covered under national program which provides free treatment to all TB cases. So it is an infectious disease caused by Mycobacterium tuberculosis bacteria. It generally affects the lungs but can also affect other parts of body. Most infections do not have symptoms in which it is known as latent tuberculosis. So now we'll go in detail about the drugs used in tuberculosis. So as a classification, based on their clinical utility, tuberculosis drugs are divided into 2 types, that is first-line drugs and second-line drugs. Listen carefully. So based on their clinical utility, okay, based on the clinical utility, anti-TB drugs are divided into first-line drugs and second-line drugs. Now we'll see what is first-line drugs, what is second-line drugs. So first-line drugs means the drugs that have high anti-tubercular efficacy as well as low toxicity. And these first-line drugs will be used routinely. High anti-tubercular efficacy and low toxicity. The second-line drugs have either low anti-tubercular efficacy or higher toxicity and sometimes both. Okay, sometimes second-line drugs will have low anti-tubercular efficacy or sometimes they will be high adverse effects or sometimes they will be having anti-tubercular efficacy and low anti-tubercular efficacy and high toxic effect. So these drugs, the second-line drugs are used as reserve drugs. Then now we will see the drugs in like what are the first line drugs and what are the second line drugs. So in first line drugs, the drugs coming under first line drugs are isoniazid, rifampicin, pyrazinamide, ethambutol and streptomycin. These are the first line drugs. Okay, this is very important concept in medical surgical nursing when we study about a communicable disease. Even when you study the community health nursing, these drugs like the drugs used in tuberculosis also is very important in your syllabus. So first line drugs is isoniazid, rifampicin, pyrazinamide, ethambutol and streptomycin. Second line drugs ethionamide, thiacetazone, para-aminosalicylic acid, amikacin, capreomycin, cycloserine, ciprofloxacin, rifampicin, kanamycin, and rifampicin. These are the drugs that is coming under second line drugs. Even in pharmacology, that drugs classify the drugs used in tuberculosis. That is a repeated question, okay, for BSc nursing. So first line drugs are isoniazid, rifampicin, pyrazinamide, ethambutol and streptomycin. Second line drugs ethionamide, thiacetazone, para-aminosalicylic acid, amikacin, capreomycin, cycloserine, ciprofloxacin, rifampicin, kanamycin and rifampicin. Okay, so according to their clinical utility, tubercular anti-TB drugs are classified into first-line drugs and second-line drugs. First-line drug is based on the these drugs have high anti-tubercular efficacy and low toxicity. These drugs are used routinely. And second-line drugs means they have low anti-tubercular efficacy or sometimes they will be having higher toxic effect. So then based on the anti-tubercular activity, again, one more classification that is based on anti-tubercular activity. These anti-TB drugs are classified into tuberculocidal agents and tuberculostatic agents. I think hope you're remembering about the like antimicrobial agents. Okay, when we studied about the antibiotics, there was a classification that antimicrobial agents are divided into two categories. That is bactericidal agent and bacteriostatic agents. So bactericidal means the particular drugs that kills the like bacterial agents, and bacteriostatic means the drugs that like suppress the growth of particular bacterial agents. So same way here we are categorizing based on the anti-tubercular activity. We are categorizing the drugs into tuberculocidal agents and tuberculostatic agent. Tuberculocidal means that kills the tuberculo the tubercular bacteria, and static means the suppress the growth of particular tubercular bacteria. So now we will see some of the drugs that comes under tuberculocidal agent, that is isoniazid, rifampicin, streptomycin, pyrazinamide, capreomycin, kanamycin, ciprofloxacin. Static agents are ethambutol, ethionamide, thiacetazole, cycloserine, para-amino-salicylic acid. So now we will see the mechanism of action of this like anti-TB drugs. So different tuberculosis drugs are having different mechanism of action. So for example, I can give some of the drugs like isoniazid. So it is a tuberculocidal drugs that acts on intra and extracellular organism, and it inhibits the mycolic acid synthesis. Okay, some tuberculosis drugs, what happens? It will inhibit the mycolic acid synthesis. So you will be knowing that this mycolic acid, it is an important component of the mycobacterial cell wall. So these particular, when these drugs, what happens when we take when we are giving for tuberculosis, these drugs enters the mycobacteria and it is converted to an active metabolite. Okay, so thus what happens these anti-tubercular drugs inhibits the mycolic acid synthesis, and mycolic acid is an important component of the mycobacterial cell wall. And some other drugs like rifampicin, what happens? It acts on the intra and extracellular organism, both intracellular organism and extracellular organism, and it will inhibit the DNA dependent RNA synthesis. And some other organism that act as tuberculocidal agents that kills the intracellular organism, and they may be active in acidic pH. And drugs like streptomycin and ethambutol, they are streptomycin is tuberculocidal that acts on extracellular organism, and drugs like ethambutol, that is tuberculostat, that inhibits the tubercle bacilli in the walls of the cavity. So these are the various mechanism of action. Okay, then again we will see a symbol in a nutshell. We can categorize the mechanism of action of tubercular drugs into three categories. That is the drugs that inhibits protein synthesis, that inhibits the cell wall synthesis, and other mechanisms like the drugs which inhibits mycolic acid synthesis, which hydrolyzes the isonicotinic acid. Okay, so now we will see the mechanism of action of various anti-tubercular drugs depending upon the agents may vary. So we have categorized again the mechanism of action into three ways. Okay, into simple three ways. That is the drugs that inhibits the protein synthesis like streptomycin, kanamycin, rifampicin, and capreomycin. These are the some of the four drugs that inhibits the protein synthesis, and the drugs that inhibits the cell wall synthesis are cycloserine, isoniazid, and ethionamide. And the other actions like some drugs like isoniazid again can hydrolyze the isonicotinic acid, and drugs like ethionamide directly inhibits the mycolic acid synthesis. This is the mechanism of action of various anti-tubercular drugs. So this is a repeated question, classification of anti-TB drugs and the mechanism of anti-TB drugs. It is a frequently asked question in pharmacology, and sometimes they may ask the medical management in medical surgical nursing, and even in community health nursing also you can expect this question. So now let's revise. So today we have discussed about the classification of anti-tuberculosis drugs. So based on their clinical utility, it is classified into first line drugs and second line drugs. First line drugs means it have high anti-tubercular efficacy and low toxicity. These drugs will be used routinely. Second line drugs means it will have either low anti-tubercular efficacy or higher toxicity. Sometimes it may show these two characteristic features like low anti-tubercular efficacy and higher toxicity. They are used as reserve drugs. So we have seen some of the drugs that comes under first line drugs and second line drugs. The major drugs are isoniazid, rifampicin, pyrazinamide, ethambutol, and streptomycin. In second line, ethionamide, thiazidazole, para-aminosalicylic acid, amikacin, capreomycin, cycloserine, ciprofloxacin, rifampicin, kanamycin, rifampicin. Okay, then again, based on the anti-tubercular activity, the drugs are classified into tuberculosidal agent and tuberculostatic agent. Again, we have seen examples like drugs that kills the mycobacterial bacteria are isoniazid, rifampicin, streptomycin, pyrazinamide, capreomycin, kanamycin, and ciprofloxacin. Tuberculostatic agents are ethambutol, ethionamide, thiazidazole, cycloserine, para-aminosalicylic acid. Okay, now we have revised. Now we will revise about mechanism of action of the anti-tubercular drugs. That is, some drugs that acts on the that inhibits the mycolic acid synthesis. Some drug they will inhibit the DNA dependent RNA synthesis. Some drugs even what happens, they will inhibit the tubercular bacilli in the walls of the cavities, and some acts on the extracellular organism. So we have categorized into simple way, that is drugs that inhibits protein synthesis, drugs that inhibit cell wall synthesis, and the drugs that hydrolysis isonicotinic acid or inhibits mycolic acid synthesis. And under each categories we have seen few examples. So hope you have understood. So tuberculosis drugs രണ്ട് വിധത്തിലാണ് ക്ലാസിഫൈ ചെയ്തിരിക്കുന്നത്. ഫസ്റ്റ് ലൈൻ ഡ്രഗ് ആയിട്ടും സെക്കൻഡ് ലൈൻ ഡ്രഗ് ആയിട്ടും ഉണ്ട്. അത് ബേസ്ഡ് ഓൺ ക്ലിനിക്കൽ അവൈലബിലിറ്റി ആണ് നമ്മൾ ഈ ഡ്രഗ്സിന് ക്ലാസിഫൈ ചെയ്തിരിക്കുന്നത്. ഫസ്റ്റ് ലൈൻ ഡ്രഗ് എന്ന് പറഞ്ഞാൽ അതിന് ഹൈ ആയിട്ടുള്ള ആന്റി ട്യൂബർക്കുലർ ആക്ഷൻ ഉണ്ടായിരിക്കും. അതിന് അതിന്റെ അഡ്വേഴ്സ് ഇഫക്ട് കുറവായിരിക്കും. അത് റൂട്ടീൻലി നമ്മൾ യൂസ് ചെയ്യുന്ന ഡ്രഗ് ആണ്. സെക്കൻഡ് ലൈൻ ഡ്രഗ് എന്ന് പറഞ്ഞിട്ട് ലോ ആയിട്ടുള്ള ആന്റി ട്യൂബർക്കുലർ എഫിക്കസി ഉള്ളൂ, പക്ഷെ അഡ്വേഴ്സ് ഇഫക്ട് കുറച്ച് ടോക്സിക് എഫക്ട് കുറച്ച് കൂടുതലായിരിക്കും. ചിലപ്പം ചില സെക്കൻഡ് ലൈൻ ഡ്രഗ്സ് എഫിക്കസിയും കുറവായിരിക്കും, അതേസമയം അഡ്വേഴ്സ് എഫക്ട് കൂടുതലായിരിക്കും. പക്ഷെ ഇത് റിസർവ് ഡ്രഗ്സ് ആയിട്ടാണ് നമ്മൾ യൂസ് ചെയ്യുന്നത്. അപ്പൊ ഫസ്റ്റ് ലൈൻ ഡ്രഗ്സിൽ വരുന്ന ഡ്രഗ്സ് ഏതൊക്കെയാണെന്ന് കണ്ടു, സെക്കൻഡ് ലൈൻ ഡ്രഗ്സിൽ വരുന്ന ഡ്രഗ്സ് ഏതൊക്കെയാണെന്ന് കണ്ടു. അതുപോലെ തന്നെ ആന്റി ട്യൂബർക്കുലർ ആക്ടിവിറ്റി, അതായത് ബേസ്ഡ് ഓൺ ദി ആക്ഷൻ ഓഫ് ദി ട്യൂബർക്കുലർ ബാക്ടീരിയനെ ചില ഡ്രഗ്സ് എന്ന് പറഞ്ഞിട്ട് സിഡൽ ഏജൻസ് ആണ്. അതായത് അത് കംപ്ലീറ്റ് ആയിട്ട് ബാക്ടീരിയനെ കില്ല് ചെയ്യുന്നുണ്ട്. സ്റ്റാറ്റിക് എന്ന് പറഞ്ഞിട്ട് ബാക്ടീരിയൽ ഗ്രോത്തിനെ സപ്രസ് ചെയ്യുന്നുണ്ട്. അതാണ് ട്യൂബർക്കുലോസിഡൽ ഏജൻസും ട്യൂബർക്കുലോസ്റ്റാറ്റിക് ഏജൻസും തമ്മിലുള്ള വ്യത്യാസം. അതിന്റെ അണ്ടറിൽ നമ്മൾ ഫ്യൂ എക്സാമ്പിൾസ് കണ്ടു. പിന്നെ മെക്കാനിസം ഓഫ് ആക്ഷൻ നമ്മൾ പറഞ്ഞു, ചില ഡ്രഗ്സ് എന്ത് ചെയ്യണം, സെൽ വാളിൽ ആക്ട് ചെയ്യും. ചിലത് മൈക്കോളിക് ആസിഡ്, അതായത് നമ്മുടെ ബാക്ടീരിയ മൈക്കോബാക്ടീരിയം പിന്നെ ഒരു ഇമ്പോർട്ടന്റ് ആയിട്ടുള്ള കോമ്പോണന്റ് ഉണ്ട് മൈക്കോളിക് ആസിഡ്. ചില ഡ്രഗ്സ് എന്ത് ചെയ്യും, മൈക്കോളിക് ആസിഡിനെ ഇൻഹിബിറ്റ് ചെയ്യും. ബാക്കി ആക്ഷൻസ് അല്ലെങ്കിൽ ചില ആ ബാക്ടീരിയ അതുപോലെ തന്നെ കില്ലാവും. സോ ചില ഡ്രഗ്സ് എന്ത് ചെയ്യും, പ്രോട്ടീൻ സിന്തസിസിനെ ഇൻഹിബിറ്റ് ചെയ്യും. ചില ഡ്രഗ്സ് എന്ത് ചെയ്യും, they will inhibits the ATP synthesis അല്ലെങ്കിൽ they will inhibits the DNA dependent RNA synthesis. So ഇതിന്റെ അടിസ്ഥാനത്തിൽ നമ്മൾ ഡ്രഗ്സിനെ 3 വിധത്തിൽ ക്ലാസിഫൈ ചെയ്തിട്ടുണ്ട്. പ്രോട്ടീൻ സിന്തസിസിനെ ഇൻഹിബിറ്റ് ചെയ്യുന്ന ബാക്ടീരിയാസ് കുറച്ച് എക്സാമ്പിൾസ്, സ്ട്രെപ്റ്റോമൈസിൻ, കാനമൈസിൻ, റിഫാംബിസിൻ എക്സെട്ര. സെൽ വാൾ സിന്തസിസിനെ ഇൻഹിബിറ്റ് ചെയ്യുന്ന സൈക്ലോസിറിൻ, ഐസോനിയാസിഡ്. അതുപോലെ മറ്റു മെക്കാനിസംസ് ലൈക്ക് ചിലപ്പോൾ ഐസോനിക്കോട്ടിനിക് ആസിഡിനെയൊക്കെ ഹൈഡ്രോലൈസിസ് ചെയ്യുന്ന ഡ്രഗ്സ് ഉണ്ട്, അത് ഐസോനിയാസിഡ് ആണ്. അതുപോലെ തന്നെ എത്തിയോനമൈഡ് പോലത്തെ ഡ്രഗ്സ് ഒക്കെ directly mycolic acid synthesis inhibit ചെയ്യുന്നു. So hope you have understood, and once again I'm repeating, this is a frequently asked question in NACE syllabus. Thank you.